Join Chelsea King, Executive Director of the Oregon Health and Education Collaborative, as she interviews Cara Copeland, the Executive Director of the Oregon Association of Relief Nurseries. What are relief nurseries?
I think about what some people say, little babies, not little trees. We are infant and early childhood mental health centers. And what does that mean? That means we support that relationship between that parent and child. We support the mental health of how that young brain is developing. And we do that in three ways, primary ways. Our therapeutic early childhood program, we bring children into the classroom. We have meals. We have trained staff who are working to reduce the impacts of trauma on children. Can talk more about that. It's super fascinating to me. That's the one thing that we do. Then we do home visiting. So we're going, those same teachers and other home visitors go into the homes of parents, and we're essentially doing parent coaching, coming alongside that parent and saying, this is what you are already doing well. You're doing great. And what are your questions? And then parenting education. All relief nurseries in Oregon provide parenting education, different kinds of classes, whether it's mothers and babies for postpartum depression, Circle of Security, which is an attachment-based parenting, nurturing parenting, different kinds of parenting classes that we offer all the time, and both in-home, we offer those in the center. Some relief nurseries offer those online. So those are the three legs of a three-legged stool. And then think about the wraparound support that families need. Oh, you need diapers and clothing. You need to meet with a therapist. You need connection to an AA meeting. You need someone to go with you to court. Those are some of the wraparound things that we do, and as part of how we holistically look at how is this family showing up in their community.
So one of the things I'm aware of when we talk about this first 1,000 days is like that mom guilt or, mom shame that sometimes comes up around like, well, the caregiver, who's statistically often a female or a mother, gosh, that's a lot of pressure, like game on for a small window. So what would you say to parents who may have already lived that phase and are thinking about, oh, how did I do?
Yeah. No, I mean, I think it's a real question, one that I have myself. I have three children who were born within 3 years of one another. And I worked full time. So I also, I think society, one, sets unrealistic expectation for parenthood. So that's one. Number two is that the choices that parents have are unfair, and we are a product of our system. We could fully fund childcare 100% for the first 5 years of life so that mothers who needed to work had a place to have their children. We could provide universal income so that a mother who wanted to be home had that opportunity and didn't have to work 3 part-time jobs. So those are, I can go on. There's a whole nother commentary of how we have not centered the child in our public policy, how we've not centered the child in our funding decisions.
If the system actually worked on behalf of our youngest humans and, their parents and their caregivers, right? If the system was actually working to create an equitable opportunity for every single child who was born in Oregon, because it doesn't right now, right? We're forced to make difficult choices, or we're not even provided a choice because there's such limited opportunity. And as you know, that's really what the Upstream Initiative is focused on, is starting to ask communities around the state to describe what that system would look like.
I can give you the data from what 1,700 parents in Oregon are experiencing. All right. We served 1,700 parents last year. When we do our enrollment intakes, we're looking at what are the stressors and barriers that this parent is experiencing. And I can tell you, we're, the families that we are serving, the number one thing is lack of resources. So it's unemployment, it's underemployment, followed by lack of access to adequate childcare supplies, lack of social supports, inadequate childcare, not just the child carrying supplies like diapers and wipes and the basic things that you need to care for young people, but childcare, food, lack of access to food, and then it's struggling with addictions and mental health. And I can tell you that addictions and the mental health aren't the core problem. They are a result of these other issues that are about social inequality. Imagine if we were stood around in a circle, policymakers, people in charge of state funding, private funding, neighbors, and we have this young family, a parent and two parents and a child. If that child is born into this world with everything that it needs, how do we reduce those stressors that are impacting that parent's ability to see their child? Well, if they don't have to worry about food, if they don't have to worry about healthcare, and if they don't have to worry about income and where they're going to sleep, what if we reduced all of those barriers and they just went away? What would that mean for all of Oregon's children? If we can do for the ones furthest from opportunity as well, we will do for all children in Oregon. Thank goodness that we have kids up to age 5 automatically on the Oregon Health Plan. We're one of the few states that is doing that, and I'm very grateful for that. But what if every parent had also access to really quality health insurance and health care? I just feel like these are some basic rights and basic things that we can do. I cannot go without talking about how we have systemic racism, and that our children that are growing up in Black, Brown, and Native families are struggling worse than our children growing up in white families disproportionately. Relief nurseries are family resource centers who can be the hub to operate programs like Grandma's to Go, like Family Nurturing Center down in Medford operates that program down there. Having these hubs, which we have system-wide hubs, these early learning hubs that help to support this work, but these community-based programs, community-based agencies like Relief Nurseries can be the places where you can go and show up. We've got a staff training infrastructure in place, and it really it takes dollars. Quite simply, it just takes dollars. If the dollars are there, communities want to love babies. I mean, it is not hard. They want to take care of their babies. If I had the resources, every community would develop a relief nursery. We have to continue to look at what is it going to take to stabilize families in Oregon. Having a scarcity mindset is where we get stuck, and feeling like we need to plug holes and patch what's happening downstream is very expensive. But moving resources like what OHEC is doing, moving those to upstream initiatives like relief nurseries, like other home visiting programs, there's more bang for your buck.
Well, thank you for what you're doing for relief nurseries around the state, and just for the time, obviously, that you gave to me today, and what I know you're going to continue doing in the coming days, months, and years.
Yeah. Thanks, Chelsea. It's great to spend time with you, and I look forward to seeing what happens with OHEC.
Yeah, thanks. We'll drop some links into the description on the YouTube channel so folks can find out how to get involved with their local relief nursery or learn more.
Great. Thanks so much.
Okay. Thank you. Bye-bye.
Bye.